Hello everyone, today I'm going to discuss whether we should use vitamin C and the zinc for COVID-19 patients, especially for mild and moderate patients. For this discussion, I'm talking about a recently published paper in a very important journal. The study looked at the given vitamin C and the zinc for mild COVID illness. Zinc gluconate and the vitamin C with another name, ascorbic acid, are very commonly available over-the-counter medication the people use for the viral infection, and they can easily find in a market just like GNC or Giant Eagle. Zinc is known to play a role in our immune function by helping to produce antibodies in addition to helping our white blood cell to fight the virus or the infection agents. And also when it comes to the neutrophil, which is a very important white blood cells especially, there is also some evidence that zinc deficiency increases pro-inflammatory cytokines, which is very bad for our body. Also, studies done on the first SARS virus have shown that zinc might be able to inhibit its ribonucleic acid polymerase, that is the enzyme that allows the virus to replicate its RNAs, so virus will not have a chance to replicate itself. Vitamin C is an antioxidant that may play a role in our immune system, and it has an ability to fight infection. There have been in vitro and in vivo studies on chicks that have shown that it could have a protective effect against the coronavirus. And human trials have found that it may decrease the susceptibility to viral respiratory infections. When it comes to the common cold, there is limited evidence to suggest a high doses of the oral vitamin C and the zinc might reduce the duration of the symptoms and the decrease of the severity of the symptoms. What does that mean for real life? There are 13 studies which showed that if zinc is taken within the first 24 hours of the very first signs of the cold, it might reduce the length of the cold by a day. For vitamin C, there is some research suggested that it can shorten the cold by 8% in adults and 13% in kids. But it doesn't appear to be helpful if it is taken after the symptoms start. Vitamin C in the intravenous form has also been looked at for non-COVID patients, and the results are variable, so there is a meta-analysis reviewed its use on critically ill patients, and it failed to show a significant association with mortality. However, there are variable associations with secondary endpoints, including duration of the disease and the patient requiring a breathing tube, the ventilator, and the length of the stay in the hospital or in the intensive care unit. What about zinc and vitamin C for treatment of COVID-19? So I'm talking about this paper. The COVID-A to Z study was prospective, randomized, clinical, open-label trial, and multiple hospitals within the single health system, involving the sites in Ohio and Florida. Enrolled participants remained in their own home settings, and all study visits and the procedures were conducted virtually via telephone, email, or computer. So I'm not talking about the hospitalized COVID patients. Here, I'm talking about patients with mild, perhaps moderate illness. So there's a total of 214 patients were randomized, 132 of women and 32 of men, and average age was 45. Patients were randomized 1:1:1:1 ratio. What I mean, 1/4 of the patients received vitamin C, and 1/4 received zinc, and 1/4 received both vitamin C and zinc, and the other fourth, the last fourth, received the standard of the care only, which really means nothing more than rest and hydration, and maybe some Tylenol and ibuprofen for fever, but no other supplements. The vitamin C group received 10 days of 8,000 mg of vitamin C after being diagnosed with COVID based on PCR testing, and the zinc group received 50 mg of zinc gluconate. The vitamin C and the zinc group received 8,000 milligram vitamin C and 50 milligram of the zinc, the same. So we are talking about big doses, high doses of vitamin C and zinc here, much more than what most people take daily basis. For the group that received both zinc and vitamin C, there wasn't any significant difference in any of the secondary outcomes, either including number of days to reach the absence of fever, cough, shortness of breath, or fatigue. In the study, both the number of hospitalization and the deaths did not significantly vary among the 4 treatment arms. And less than 10% patients experienced adverse effect that was related to vitamin C or zinc. Adverse effects were nausea, diarrhea, and stomach cramps, which was seen in vitamin C and the zinc group. Based on interim analysis of the study was stopped early due to futility of the study. If zinc is taken in high doses, especially more than 40 milligram per day, it's been shown to cause the dry mouth, nausea, loss of appetite, and diarrhea, and nasty metallic taste. In long term, users can develop low levels of copper and decreased immunity and lower levels of the good cholesterol, HDL. Back in 2009, there's an FDA warning over the zinc nasal sprays that there is a link over the 100 cases of people using lost their sense of smell. Taking over the 2,000 milligram of vitamin C can cause heartburn, stomach cramps, nausea, vomiting, diarrhea, and headache. The average daily recommended amount of vitamin C is 90 milligram for men, 75 milligram for women. In the study, participants who received vitamin C, which is 8,000 milligram a day, this group had a significantly higher proportion of nausea, diarrhea, and stomach cramps. What are the limitations of this study? There was no placebo group or placebo control group. It was an open label study, so participants knew what they were taking, and also we don't know what their previous vitamin C and zinc levels. Most people are not vitamin C or zinc deficient, so it is reasonable to assume that deficiency did not have any effect on the results of the study. And also in this study didn't look at the effects of the vitamin C and zinc on severe COVID-19 patients. Currently there are clinical trials in China and in the United States that are looking at potential role of intravenous vitamin C and reducing the need for requiring ventilator for COVID-19 patients. One more point of this trial is we don't know the vitamin D, since vitamin D deficiency is associated with increased risk of COVID-19 infection and increased risk of hospitalization and intubation. There are randomized control trials being done to see if vitamin D supplementation can be beneficial for COVID-19 patients. I will probably do a video about this subject in a very pretty soon. And that's all for now. Thanks for watching. If you haven't done so already, make sure you click on the subscribe button please, and that bell notification so you can see my next video when it comes out.